Hey everybody, and welcome back to Student Nurses Station. I'm Nurse Don.
And I'm Nurse Jill.
Don't forget to hit that like button and share with your friends and subscribe to the channel so you don't miss any of our awesome nursing content.
You know it.
And hey, speaking of awesome nursing content, be sure to check out the link in the description for some free e-downloadable nursing books to help you ace those exams.
Right.
We know you're busy studying and working and maybe even trying to have a life outside of nursing school.
Yeah.
So feel free to listen while you're commuting or cleaning the house or even folding laundry. We're here to make learning as painless as possible.
Absolutely. So are you ready to dive into one of the most essential skills in nursing?
You bet. Let's talk head-to-toe assessment. It sounds pretty straightforward.
Yeah.
You know, check the patient from head to toe. But what's the real significance for nurses?
It's like being a detective, you know? Instead of searching for clues at a crime scene, we're looking for subtle signs and symptoms all over the patient's body. These clues help us understand their overall health status and spot potential problems early on.
So it's not just a routine check. We're really trying to piece together a whole picture of their health.
Exactly. Think of it like this. You can tell a lot about a person's overall health just by examining their skin. Changes in color or texture or temperature can be the first clue to dehydration or circulation problems, or even underlying conditions like liver disease. That's why a systematic head-to-toe approach is so crucial.
Okay, that makes sense. So how do we actually approach this head-to-toe assessment? Is there a specific method?
We rely on 4 main techniques: inspection, palpation, percussion, and auscultation. Think of these as our trusty tools for gathering information. We use inspection, our senses of sight, smell, and hearing throughout the assessment. It's amazing what you can pick up just by carefully observing the patient.
Right, like noticing if someone is pale or sweating or if their breathing sounds labored. But what about the other techniques? Palpation sounds pretty hands-on.
It is. Palpation is all about using our hands to feel for things like texture, temperature, moisture, and tenderness. It's how we check a patient's pulse or feel for swollen lymph nodes or assess the firmness of their abdomen.
So we're literally getting a feel for what's going on under the surface.
Exactly. Now, percussion might sound a little strange, but it involves tapping on different parts of the body and listening to the sounds that it produces.
Like we're playing a human xylophone.
Yeah.
What kind of information can you get from that?
You'd be surprised. By listening to the resonance, we can tell if an organ is enlarged, or if there's fluid in a cavity, or even if a lung is filled with fluid, which could indicate pneumonia. It's a subtle art, but super valuable.
Wow, it's amazing how much you can learn just by tapping and listening. And finally, there's auscultation, I know, that involves the stethoscope.
Yes, auscultation is all about listening to the sounds produced by the body's internal organs, like the heart, lungs, and bowels. It's like eavesdropping on the body's internal symphony to make sure everything is in harmony.
Okay, so we have these 4 techniques: inspection, palpation, percussion, and auscultation. But with so much information to gather during a head-to-toe assessment, are there any tools or tricks to help us stay organized?
Absolutely. We use something called the COLDSPA mnemonic to help us systematically explore each symptom the patient reports.
COLDSPA. Tell me more about that.
It stands for character, onset, location, duration, severity, pattern, and associated factors. So, for example, if a patient is complaining of pain, we would use COLDSPA to gather all the details. What does the pain feel like? When did it start? Where is it located? How long does it last? How bad is it? What makes it better or worse? And are there any other symptoms that accompany the pain?
So COLDSPA helps us paint a detailed picture of each symptom, ensuring we don't miss any crucial information.
I like it. It's a great tool to have in your nursing toolkit. Now, with our techniques and our handy mnemonic in mind, let's actually walk through the components of a head-to-toe assessment. Where do we start?
It seems like we should start with the basics. What's the first step?
Before we dive into specific body systems, we always begin with a general survey. This is where we form our first impression of the patient. We observe their overall appearance, their posture, how they're moving, their level of alertness, and even their mood.
So we're getting a feel for their overall well-being, even before we start checking their pulse or listening to their lungs.
Exactly. It's like setting the stage for the more detailed assessment to come. We also take their vital signs during this initial phase: temperature, pulse, respirations, and blood pressure. These are key indicators of how well their body is functioning.
Right. The vital signs give us that baseline measurement of their physiological state. What comes next?
We move on to the chief complaint. This is where we really listen to the patient and understand why they're seeking care in their own words.
So we're making sure their voice is heard and understanding their primary concern.
Absolutely. The chief complaint helps us focus our assessment and prioritize our interventions. Then we delve into the patient's health history. This is where we gather information about their past and present medical conditions, any surgeries they've had, their family history of illness, any medications they're taking, allergies, and lifestyle habits.
It sounds like the health history is crucial for connecting the dots and seeing the bigger picture.
It absolutely is. It helps us understand their overall health trajectory and identify potential risk factors. And from there, we move on to the integumentary assessment, which focuses on the skin, hair, and nails.
Why is the integumentary assessment so important? Can it really tell us that much about a patient's overall health?
You bet it can. The skin is our largest organ, and it's often a reflection of what's going on internally. Think of it as a window into the body's systems. For example, you might think tapping on someone's back sounds silly, but by listening to the resonance, you can actually tell if their lungs are filled with fluid, which could indicate pneumonia.
Wow, that's incredible. So what exactly are we looking for when we assess the skin, hair, and nails?
We start by asking the patient about any current skin problems they're experiencing, like rashes, dryness, itching, or any changes they've noticed in their skin, hair, or nails, like changes in color, texture, or thickness. Then we use our inspection and palpation skills to get a closer look.
What are some of the things we're looking for during the examination?
When it comes to the skin, we're inspecting for color variations, any lesions or wounds, the texture and thickness of the skin, how moist or dry it is, temperature, how easily it moves, and we check for something called turgor, which tells us about the skin's elasticity and hydration status. We also look for any swelling known as edema.
So we're looking for any clues that might indicate a problem, whether it's related to circulation, hydration infection, or something else entirely.
Exactly. And for the hair, we inspect and palpate the scalp, looking for anything unusual like lesions, flaking, or parasites. We also assess the hair's texture, distribution, and quantity. These can provide insights into nutritional deficiencies or hormonal imbalances.
It's fascinating how these seemingly simple observations can reveal so much about a person's health.
It really is. And lastly, for the nails, we inspect their grooming, color, shape, texture, and capillary refill, which tells us about their circulation. We're looking for any signs of fungal infections, nutritional deficiencies, or circulation problems.
This is all so interesting. I'm starting to see how each part of the body can give us clues about the overall health of the patient.
And that's the beauty of the head-to-toe assessment. It allows us to connect the dots and develop a comprehensive understanding of our patient's needs.
I'm ready to hear more, but I think we'll have to save that for part 2.
You got it. Stay tuned, folks, because we're just getting started. Welcome back to Student Nurses Station, everyone. We're about to continue our journey through the head-to-toe assessment.
I'm ready for more. Last time we covered the integumentary system. Where are we headed next?
Now we're going to move up north to the head and neck. It's a critical area because it houses so many vital structures.
Okay, the head and neck. It seems like a pretty straightforward area.
Yeah.
But what kind of things are we specifically looking for in this region?
You'd be surprised how much information we can gather just by carefully examining the head and neck. We're focusing on the skull, the face, the thyroid gland, the lymph nodes, and all the structures in between. We're looking for any signs of abnormalities, asymmetry, swelling, tenderness, or anything that could indicate a problem.
So it's a very thorough inspection of all the structures in this area.
Exactly, and we're using all 4 of our assessment techniques: inspection, palpation, percussion, and auscultation to get a complete picture.
Can you give me some specific examples of what we're looking for and how we assess it?
Absolutely. When we inspect the head, we're looking at its size, shape, and configuration. We're also observing for any involuntary movements like tremors or tics.
So we're making sure the head is symmetrical, there's no unusual tilting, and no signs of neurological issues.
Right. Then we palpate the head, feeling for any bumps, lesions, or tenderness. We also palpate the temporal artery to assess its pulse.
So we're checking for good blood flow to the head and making sure there's no inflammation in that important artery.
Exactly. And we also palpate the temporomandibular joint, or TMJ, which is the joint that connects the jaw to the skull. We're feeling for any clicking, popping, or pain, which could indicate a problem with the joint.
TMJ problems can be really painful. It's good to catch those early.
Absolutely. Now moving on to the neck. We inspect it for symmetry lumps, masses, and any unusual swelling.
We're looking for anything that disrupts the smooth contour of the neck, right?
Exactly. We also ask the patient to swallow while we observe the movement of the thyroid cartilage. That's the Adam's apple and the thyroid gland itself. This helps us assess for any thyroid enlargement or abnormalities.
So we're looking for a smooth up and down movement, And any signs of a goiter, which is an enlarged thyroid.
Precisely. And we assess the range of motion of the neck, asking the patient to turn their head from side to side, tilt it forward and backward, and touch their chin to their chest. This helps us ensure there's no stiffness, muscle spasms, or pain.
It's important to check that the neck has full mobility and there's no limitation of
You
movement.
got it. We also palpate the trachea, which is the windpipe, to make sure it's midline and there's no deviation.
Why would the trachea deviate from the midline? What did that mean?
It could be a sign of a problem in the chest, like a collapsed lung or a tumor, putting pressure on the trachea and pushing it to one side. So it's a really important finding that we don't want to miss.
Wow, that's a subtle but crucial detail.
Absolutely. Then we move on to palpating the thyroid gland. We're feeling for its size, shape, symmetry, and checking for any nodules or tenderness.
We're making sure the thyroid gland feels normal and there are no signs of enlargement or lumps.
Exactly. And if we do detect an enlarged thyroid gland, we might auscultate it with a stethoscope to listen for any unusual sounds called bruits.
Bruits. What do those sound like and what do they indicate?
A bruit sounds like a whooshing or swishing sound, and it can indicate increased blood flow to the thyroid gland, which can be a sign of hyperthyroidism.
So we're listening for clues about how well the thyroid is functioning.
Precisely. And lastly, we palpate the lymph nodes of the head and neck. There are many lymph nodes scattered throughout this region, and they're part of the immune system.
What exactly are we looking for when we palpate the lymph nodes?
We're checking for any enlargement, tenderness, or hardness, which could indicate an infection, inflammation, or even something more serious.
So if they feel swollen, tender, or fixed in place, that's a red flag.
Exactly. Lymph nodes are like tiny little filters that trap bacteria and viruses. So when they're enlarged, it's a sign that the body is fighting something off.
That makes sense. So we've checked the head, the neck, the tracheas, the thyroid, and the lymph nodes. What's next on our head-to-toe adventure?
From the head and neck, we move on to the eyes, our windows to the world. This part of the assessment is fascinating because it involves not only looking at the structures of the eye, but also testing visual function.
Okay, the eyes. They're so complex and delicate. I'm curious to learn how we assess such intricate organs.
Just like with the head and neck, we use all 4 assessment techniques to gather information about the eyes. Inspection, palpation, some percussion techniques, and even specialized instruments to look deeper into the structures of the eye.
So it's a combination of observation, hands-on techniques, and specialized tools.
Exactly. We start by asking the patient about their vision, any visual problems they've been experiencing, their eye health history, and if they wear glasses or contacts. This gives us valuable subjective data to guide our assessment.
So we're gathering information about the patient's own perception of their vision and any concerns they might have.
Precisely. Then we move on to the objective part of the assessment, where we inspect the external eye structures, including the eyelids, eyelashes, eyeballs, conjunctiva, sclera, lacrimal apparatus, cornea, and lens.
Wow, that's a lot of structures. What are we looking for in each of those areas?
Well, for the eyelids and eyelashes, we're looking for any redness, swelling, discharge lesions, or drooping. We're also checking to make sure the eyelids close completely and symmetrically.
So we're making sure the eyelids are protecting the eyes properly and there are no signs of infection or inflammation.
Right. Then we observe the position and alignment of the eyeballs in the eye sockets. They should be symmetrical and not protruding or sinking.
So we're making sure the eyes are sitting properly in their sockets and there's no bulging or unusual inward displacement.
Exactly. And we inspect the conjunctiva, which is the clear membrane that lines the inside of the eyelids and covers the white part of the eye, the sclera. We're looking for any redness, swelling, or discharge, which could indicate an infection or irritation.
What are some of the things that can cause redness or swelling in the conjunctiva?
It could be something as simple as allergies or dry eyes, or it could be a sign of a more serious infection like conjunctivitis, commonly known as pink eye. So it's important to note any abnormalities and investigate further.
Makes sense. What else are we looking for in the eye?
We also inspect the sclera, which should be clear and white. Yellowing of the sclera, known as jaundice, can be a sign of liver problems. Then we inspect the lacrimal apparatus, which is the system that produces and drains tears. We're checking for any swelling, redness, or discharge, which could indicate a blockage or infection.
So we're making sure the tear ducts are functioning properly and the eyes are staying lubricated.
Exactly. And then we inspect the cornea, which is the clear outer layer of the eye for any cloudiness, scratches, or irregularities. A healthy cornea is crucial for clear vision.
What can cause cloudiness or irregularities in the cornea?
It could be due to a variety of things, including infections, injuries, or certain diseases. One condition that causes clouding of the cornea is called keratosis, where the cornea thins and bulges outward, distorting vision.
Wow, that's serious.
It is. And finally, we inspect the lens, which is located behind the pupil, for any cloudiness which could indicate a cataract. Cataracts are a common age-related condition where the lens becomes cloudy, making it difficult to see.
So we're checking for those signs of cataracts which can really impair vision.
Precisely. After inspecting the external eye structures, we move on to testing the pupils. We're checking their size, shape, symmetry, and their reaction to light.
How do we test the pupil's reaction to light?
We dim the lights in the room and shine a pen light into each eye one at a time, observing how the pupils constrict. They should constrict quickly and equally.
What does it mean if one pupil constricts more slowly or to a lesser degree than the other?
That can be a sign of a problem with the nerves or muscles that control the pupil, or it could indicate a problem within the brain itself. It's definitely something that requires further investigation.
That's incredible how something as simple as the pupil's reaction to light can tell us so much.
It really is. The eyes are a window to the nervous system, and even subtle changes can be significant. We also test the pupil's accommodation, which is their ability to adjust their focus from a distant object to a near object.
How do we test accommodation?
We hold an object about 12 to 15 inches in front of the patient's eyes and ask them to focus on it. Then we slowly move the object closer to their eyes and observe how their pupils constrict and their eyes converge, meaning they turn inwards slightly.
So we're checking to make sure the eyes can adjust their focus smoothly and efficiently.
Exactly. This ability to adjust focus is crucial for everyday activities like reading and driving.
So we looked at the external features. We've checked the pupils. Is that all we do for the eye assessment?
We might also use an ophthalmoscope to inspect the internal eye structures. This is a specialized instrument that allows us to see the retina blood vessels, optic disc, and other structures inside the eye.
Wow, that sounds pretty high-tech. What are we looking for when we examine the internal eye structures?
We're looking for any signs of abnormalities, such as hemorrhages, swelling, abnormal blood vessel growth, or optic disc swelling. These findings could indicate various eye diseases or even systemic conditions like hypertension or diabetes.
So the ophthalmoscope helps us detect problems that we wouldn't be able to see with the naked eye.
Exactly. It's a powerful tool for assessing eye health. And in addition to inspecting the eyes, we also assess the patient's vision.
How do you do that?
We test their visual acuity, which is the sharpness of their vision, using a Snellen chart. That's the chart with a big E at the top and rows of progressively smaller letters. We also assess their peripheral vision and color vision using different techniques.
So we're getting a comprehensive picture of the patient's overall visual function.
You got it. The eye assessment is a crucial part of the head-to-toe assessment, and it can reveal a lot about the patient's eye health and overall well-being.
This has been incredibly informative.
Yeah.
It's amazing how much detail goes into assessing just the eyes.
You're telling me, and we're not done yet. Next up, we're going to delve into the assessment of the ears, nose, mouth, and throat.
All right, bring on those sensory powerhouses. I'm ready to keep learning.
Welcome back to Student Nurses Station. I'm feeling like a seasoned head-to-toe detective after those last two segments.
You're catching on quickly. Ready to tackle the ears, nose, mouth, and throat.
Absolutely. These organs play such a crucial role in our senses and how we interact with the world. I'm ready to learn how we assess these sensory powerhouses.
Great. Let's start with the ears. We'll be focusing on both hearing and equilibrium, which is our sense of balance. For this part of the exam, we'll be using inspection, palpation, and of course, our trusty otoscope.
Ah, yes, the otoscope. That's the instrument with the light and the magnifying lens, right? What exactly are we looking for when we peer into those ear canals? First, we check the outer ear, the part you can see called the auricle or pinna. We're looking for any redness, swelling, discharge lesions, or masses. We also want to make sure everything looks symmetrical on both sides.
So we'll make sure the ears are structurally sound and there are no obvious signs of infection or injury.
Right. Then we use the otoscope to visualize the ear canal and the tympanic membrane, which is also known as the eardrum.
What are we looking for in the ear canal and eardrum?
We're checking the ear canal for any redness, swelling, discharge, foreign objects, or blockages. And for the eardrum, we're looking at its color, shape, and integrity.
What should a healthy eardrum look like?
A healthy eardrum should look like a tiny, taut drum head, pearly gray and slightly curved inward. If you see any bulging redness or holes, it could be a sign of infection or fluid buildup behind the eardrum.
So we're checking for signs of otitis media, which is a middle ear infection, or any other problems that could be affecting hearing.
Exactly. And of course, we also assess the patient's hearing during this part of the exam.
How do we do that?
There are a few different ways to assess hearing. We might ask them to repeat certain words or phrases whispered from different distances, or we might use a tuning fork to test their ability to hear different frequencies of sound.
So we're trying to determine if they're hearing clearly in both ears and if there's any hearing loss.
Precisely. Now moving on to the nose, our olfactory champion, we'll use inspection and palpation to assess its structure and function.
What are we looking for when we examine the nose?
Externally, we check for any deformities, asymmetry, swelling, redness, or skin lesions. We also check the nostrils or nares for patency, meaning that air can flow freely through them.
So we're making sure the nose is structurally sound, the septum is straight, and there are no obstructions to airflow.
Right. We might also palpate the sinuses, which are air-filled cavities in the skull that are connected to the nasal passages. We're checking for any tenderness, which could indicate sinusitis.
Sinusitis is a sinus infection.
Right.
Right. What causes that?
It's usually caused by a virus or bacteria that gets trapped in the sinuses, leading to inflammation and pressure. If the patient has tenderness when we palpate their sinuses, it's a clue that they might have a sinus infection.
Okay, that makes sense. So we check the ears and the nose. What's next?
Now we're moving on to the mouth, which is the gateway to both the digestive and respiratory systems. We'll use inspection to assess its structures and functions.
What are some of the key things we're looking for when we examine the mouth?
We start by inspecting the lips, looking for color, moisture, lesions, and symmetry. Then we move on to the oral mucosa, which is the lining of the mouth. We're checking for color, moisture, lesions, and ulcers.
So we're making sure the lips and oral mucosa are healthy, well hydrated, and free from any sores or abnormalities.
Precisely. Then we inspect the teeth and gums, looking for any missing, broken, or decayed teeth, as well as any signs of gum disease like redness, swelling, or bleeding.
So we're assessing their oral hygiene and overall dental health. What can cause gum disease?
It's mainly caused by plaque, which is a sticky film of bacteria that builds up on the teeth. If plaque isn't removed regularly through brushing and flossing, it can irritate the gums and lead to inflammation, infection, and even tooth loss.
Yuck. Good oral hygiene is definitely important.
Yeah.
What else are we inspecting in the mouth?
We also examine the tongue, looking for color, texture, moisture, and movement. We're checking for any lesions, ulcers, or coatings.
So we're making sure the tongue is healthy and functioning properly. What are some things that can go wrong with the tongue?
Well, the tongue can tell us a lot about a person's overall health. A bright red tongue could indicate a vitamin deficiency, while a white coating could be a sign of a yeast infection called thrush. And changes in the tongue's texture or mobility can be a sign of neurological problems.
That's amazing.
Yeah.
It's like the tongue is a little map of what's going on inside the body.
It really is. We also inspect the hard and soft palates, which are the roof of the mouth. We're looking for their color shape and any abnormalities like a cleft palate.
And the uvula, right? That
Yeah.
little teardrop-shaped thing that hangs down the back of the throat.
Exactly. We're making sure it's midline and elevates when the patient says, ah. This tells us that the nerves that control the uvula are functioning properly.
Okay, so we've covered the lips, the oral mucosa, the teeth, the gums, the tongue, the palate, and the uvula. What's left?
Last but not least, we move on to the throat, which is the passageway for both air and food. We'll be inspecting the tonsils and the posterior pharyngeal wall, which is the back of the throat.
What are we looking for in the throat?
We're checking the tonsils for size, color, and the presence of any exudate, which is a whitish or yellowish discharge that can indicate infection. We're also inspecting the posterior pharyngeal wall for color, moisture, and any lesions or drainage.
So we're looking for any signs of inflammation, infection, or anything that looks out of the ordinary.
Exactly. And with that, we've reached the end of our head-to-toe assessment journey.
Wow. That was quite a comprehensive tour of the human body. I feel like I've learned so much.
I'm glad you found it helpful. The head-to-toe assessment is such a fundamental skill for nurses, and it allows us to gather so much valuable information about our patient's health status. It's like putting together a puzzle piece by piece until we have a complete picture.
It's definitely like detective work. And I feel much more confident now in my ability to perform a thorough head-to-toe assessment.
That's wonderful to hear. Remember, practice makes perfect. The more you practice, the more comfortable and confident you'll become.
Great advice. I can't wait to put what I've learned into practice.
Me too. And hey, before we go, don't forget to hit that like button and share this deep dive with your fellow nursing students.
Absolutely. And be sure to subscribe so you don't miss any of our future episodes.
See you on the next deep dive, everyone.
Bye, everyone. Happy nursing.